You are defining the questions, searching and screening, assessing the quality, extracting information, and discussing and concluding. Very straightforward. But there are more elaborate steps, like this from the University of Waterloo, which runs through about 9 steps for a systematic review. You are developing your research question and also assessing the need for that review, then going to creating the team, protocol, reviews, then searching for the sources, selecting them, assessing quality, extracting data. All these we are going to look into, hopefully, before the end of this workshop, because there are lots of details in each of these steps. So this is for a systematic review. And when we come to a scoping review or a systematic map, you can see a step is skipped here, which is the step of assessing quality of the study. So scoping review actually skip that step. When we do scoping review, we don't do study as a quality of study. Assessing the quality of the studies that we are including in the review. So that step makes it faster, a little faster than what we have been, and a less rigorous, because that assessment is actually it takes some time and some understanding to do. So for a scoping review, that step is also skipped here in the second version of the step. You can see this one is now 8 steps. So that quality assessment, quality of study assessment has been skipped. Then for our traditional review, our normal literature review that we do. What? Yes, it's deliberate. You know, you can see steps of systematic. We have cancelled that systematic review scope. We are now in traditional review. So the previous one was, this was scoping review. Only one step is missing. And you can even see that these 2 steps are well defined. They are showing very well. But when you get to the traditional literature review, they are not even, the questions sometimes are not well defined, and then the search and screening are not well defined. You just quickly run a search. Sometimes you can even do a literature review within 2-3 days and you are done. You continue with every other thing you want to do. So these steps are actually deliberately missing, not that, that is, as they are in systematic review, they are not here. You just quickly run your search, pick some of the studies, and then you write your review as you want to do it. So this is the traditional literature review that we do every time. Okay. So who is sure of this answer? Which of the following is not true of a scoping review? Let's test our knowledge. At least we've discussed this, so I expect this to be like, say, okay, it seems CB. Okay, good. So it seems everyone has, there's a consensus on that C is the answer. That stage is not part of. So by the time we get to quality assessment in literature, in systematic reviews, you know that we are talking about systematic review, we explain how to do it, but that phase is not part of, as you will also see in some of the guidelines that we'll be showing ourselves. Okay, so this paper, this book by Little et al. Actually brought us some more understanding about systematic reviews, and systematic review methodology. And it makes us to understand that how many of us here have conducted a survey research? Survey, you survey people or something like that. Okay, all right. So this chart is to juxtapose survey and systematic review as research methodologies. And it tells us that systematic reviews is not something new per se. Many of us are used to survey. You go to interview people, you distribute questionnaire. Even if you've not distributed questionnaire, I'm sure one way or the other, all of us have completed a questionnaire for someone at one time or the other. So this chart is saying that the systematic review methodology is not far from the survey design that we have, survey research design. So, and it's brought that down by saying, okay, when it comes to topic formulation, they both have central questions, central hypotheses, central objectives that they are trying to attend to. In terms of study design, you design your protocol for a survey, you design your protocol for a systematic review. And also you specify the problems and conditions, the population, the setting, just as you do also in survey. Then there are inclusion criteria, like as you specify the sample characteristics. I'm surveying maybe 200 level to 400 level UNIMED students. I'm excluding, you might be running a study that you are excluding the 100 level student for one reason or the other. So that means you are defining the population characteristics, and that's part of what we do here in systematic. Just that while the unit of analysis in survey is usually maybe individual or group of people or institution, what we are analyzing are the people, the subjects. In systematic review, the unit of analysis are the sources, each paper that we are including in the review, that's the unit of analysis. So we are also going to define inclusion and exclusion criteria for that, as we'll see going forward. So the table goes on like that, trying to juxtapose methodological similarity between systematic review and a survey, systematic review method. One of the confusion is that when we say systematic reviews, sometimes what comes to mind is the outcome, the output. Because at the end of the systematic review process, by going through that methodology, what you produce is also called systematic review. But we should know that it's a method in its own. It's a process in its own. Though the outcome is also called systematic, that paper or that report that comes from it is also called a systematic review. So these are methodological similarities between the survey research design and the systematic review research design. And even up to data analysis, you are going to run descriptive analysis. You can run in systematic, and you can do the same in surveys, and even differential statistics, because at some point you might be going into meta-analysis, and you'll be running, you may be running meta-regression within systematic review, just as you can be running multivariate analysis in a survey, and also down to reporting. So this table is just to let us know we shouldn't be afraid of systematic review, because we have said that it is methodologically rigorous, and it takes time and all that. Nonetheless, it's not far from what we already know. We just need to understand it, and then we can go into it and do it. And especially because we have said, if you remember, survey is at the base of the pyramid, evidence pyramid. It's just a single study. But this is at the peak because of some of the inherent characteristics that we'll see. So, in general, systematic review is trying to decrease bias, that is, bias that will have been introduced in different types of reviews, and also to increase reproducibility and transparency in our research. And how does this happen? Let's talk about bias in research synthesis. Usually when we conduct studies, we normally may have negative results and positive results. That is, some of our results give negative answer, while some give positive answer. So that's what we expect in a normal study. You collected all data, there are negative results and there are positive results. But we found that when you go higher, by the time people write report, there is a reduction. It is not aligning again, it's becoming a pyramid, and this is what happened. The reports now start tilting towards the positive results. Many reports that people publish start tilting towards the positive reports, and that is where the bias starts, and that is outcome reporting bias. You have left out the negative results, and we are trying to make decision on this problem, but most of what we are seeing are the ones that say it works. And in fact, I read a story, a report recently whereby a clinical trial actually went wrong because they missed some salient studies that should have been included in the evidence synthesis. And the subjects actually died. They ran an evidence synthesis, they were running the clinical trial on some subjects, but they missed out some studies that have actually reported that procedure they wanted to try out didn't work. So at the end of the day, yes, it's a clinical trial, you have signed that maybe anything can happen along the line, yeah. So that's outcome bias. Outcome reporting bias is part of what systematic review wants to address, and it also wants to address publication bias. That is, by the time you write your report, By the time you send it to reviewer, they also push it further to the positive results. They also push it further to the positive results up to when we have and then the last one is the confirmation bias, which is what we now have as what we want to use, usually tending more towards the positive. So, some things are not showing very well. We had to copy from my laptop to this, so maybe that's where the problem came in. But what we are saying in essence is that there are three types of biases, and systematic review is trying to to take care of this by shifting this particular evidence back to the center. All those things, reporting, the confirmation bias, the outcome bias, the publication bias, systematic review is trying to shift it back to the center, that we don't need to flush everything to the positive side. Let's know what is negative. So that's actually, and that's why we said in general, systematic review is trying to decrease bias and also increase reproducibility and replicability, transparency. So what happened is that, okay, how do systematic reviews actually address bias? One is that you make decision about selection a priori. Before you even start the study, you will have written your protocol, a clear protocol of these are the type of studies that will be in my review. So you have determined what you want to do. Not that it's when you are not doing it that you now say, no, let's not include this one. Let's include this one, So you have made that decision. You have published that decision of what you want to do. Everybody knows. By the time you publish your review, we can take your protocol and say, okay, is it what you say you want to do that you did? So you first publish a protocol before you publish a systematic review. And that is part of how it's able to assist us with addressing bias. Clear documentation of the process. As we will see, documentation is so much inherent in systematic reviews. You are going to be documenting how did you search, where did you search, how many did you get, and things like that. We are going to see as we proceed. Then there are multiple people. You cannot do a systematic review alone. Forget it. It is not possible. When you talk of systematic review, it is done by a team. And we will see the team composition in a couple of slides. So there are many independent people because, for instance, when you are screening the studies for inclusion, there must be at least 2 independent people screening. It's a methodological requirement in systematic review. At least 2 independent people screening that let's include this study, let's not include this study, based on the criteria you have set in your protocol. So, and even when you are doing the quality assessment for each study, there must be at least 2 independent people. We have a study going on that I'm part of in OAU right now. That's part of where we are stuck. Someone has finished their own screening aspect, and some of the other people are still busy not doing their work, and she's shouting out, do your work, but we cannot proceed without them. So it's a teamwork that must be done. And then comprehensive search method, as we will see when we get to the stage of search, comprehensive search method. You are going to, we are not going to, the aim of this workshop is not to turn you to a librarian or to turn you to a search expert, but we will try to make you understand. I was at the webinar yesterday or day before, I think yesterday, we were talking about use of AI for systematic reviews. And at some points, after some discussion, one of the questions that came up was that, how will people who are not search experts actually know that there is some of the problems we were seeing with AI use in systematic reviews? We were just information experts. So we were just discussing a lot of things. Someone was giving a report. And then a question came up that, okay, what of other people that are not, how will they know that these issues we are discussing are there? So that was one of the things that really became a conversation at that meeting. So what we are saying is that there's a comprehensive search method, which at least you should understand. If you see a search, protocol for a systematic, you should understand what it's saying, even if you may not be able, even if you need one of your team members to produce that comprehensive search method. Okay. Okay, we've talked about this and the aspect that systematic review is actually addressing, is attacking that publication bias. Let's switch it back to the center and all that. This is just to define publication bias. Research that appear in public literature is systematically unrepresentative of the population of completed research. Usually what we have in publications are systematically unrepresentative of everything that we have been doing in terms of research. And how is this happening? The types of when we talk of publication bias, go back to your office, go and check your locals, all those ones that you have not published, all those negative results that you are keeping away, you are not publishing, that's publication. Why are you not publishing? In fact, I could remember in my undergraduate days, for my BSc project, we didn't know anything about research anyway. When we were doing everything and everything was negative, I called my supervisor, everything is negative, what's going on? And no, not my supervisor, another lecturer that I was close with, and he said, negative result is a result now. So that was what he told me then, a negative result is a result. So usually positive results are published more than negative results, and that is part of it. So people are keeping things in their lockers, excluding things, and only outcomes showing significant reports. In fact, some people are not even just showing only outcomes. Some people are, because they've read some things in literature and they've seen that this thing is supposed to be significant. Why is it not? You just change it to 0.05. It's significant. It's significant. So when what you are seeing, what you are getting is not significant. So and that is what is called p-hacking. You are hacking p-value. You are working towards it, and that is not what we are supposed to do. Then we have bias towards English language. Most of what is published in science are published in English language, and there is a lot being done by non-English speakers that we also need. Systematic review also put this into consideration. Then we have a lot of work that go unpublished and also for various reasons that go unfinished. So many of us, a number of people, what they've done in their thesis, maybe for a degree, they usually don't publish them. So a lot of things go unpublished. Systematic review factored this into its methodology, and you must go after some of those things to actually say you are doing a systematic review. So all this we will see later. How is systematic review addressing publication bias? These are some of the things. It's including non-English articles, researching great literature, talking to experts. So in fact, it gets to a point that if you know that Professor Oyeyemi is the expert on this matter, you will call him and talk to him and say, okay, please, are you doing anything that we need to capture in our work, or do you have any work? These are the things we have seen. Do you still have more that we have not seen? So it's part of systematic review. We'll see that in the guideline. And all these other things that we are trying to use to address publication bias. Okay, we now get to the point of how do you determine, should I do a systematic review or another type of review? How do you determine that? There are a number of guidelines or guidance or frameworks online that can help us to say, okay, this is how you can actually. I could remember one of our very senior professors here, when he came to me that he wants to do systematic review, and we're talking, I was explaining some things. He said, no, we can finish it. In fact, I had someone at the beginning of this year that said, we should be able to produce like 6 systematic review this year. This year. I said, okay, let's just try and organize training first. Let's organize training, let everybody understand. Anytime you can, I say, hey, we are still working on that training. We'll do it. Because I wanted us to get to a point where we have an institutional-wide training first, and then we can now start saying, okay, we want to do systematic review. At least we have trained you, you know what it takes. Now let's sit down and talk. So there are many things that guide us to say, okay, what type of review are you trying to do? Let me see if I can zoom this in. Okay, this is not my laptop. I'll just manage it. Okay, so this one here is and this was one of the things I sent to that professor. When he was coming, I said, okay, I just sent it to him that, look at this, Prof. And after I looked at it, I said, okay, you are right. We may not be able to do systematic review now. So this flow chart actually tells us how do you decide whether you want to do a systematic review or not. And the first thing at the top is that, do you want to gather all evidence? If you say yes, then you proceed. If you say no, then just go and do your normal literature review. So Then the next question there is, do you have 3 or more people? If you say yes, then you proceed. If you say no, just do a more intensive literature review. And if you don't have 3 or more people, then it continues like that till it gets you to rapid review, scoping review, systematic review, meta-analysis, down, and so on like that. And there are some tools that we can use to online. These are hyperlinked. By the time you get the slide, write review. It will ask you some questions, just as is done in this flowchart, a series of questions. Then at the end of the day, it will tell you, this is the type of review suitable for what you intend to do. So maybe a scoping review, a rapid review. So after asking, that's the same way these 2 tools work. I think one is from, I can't remember where this was, but this is from a university in Canada. Sorry. Okay, we've talked about the steps to systematic reviews, and this representation actually tells us more about, graphically shows us what we are saying when we are talking of systematic review. We identify the issue, we plan the study, we search for studies, and all those studies, we sieve them through a sieve, and then funnel them down through a number of processes to get what we call. So this whole method is systematic review method, and the output is also systematic review. What we are producing is also systematic review. So more elaborately, these are the steps, and we'll be following these steps in this workshop. Continuing tomorrow, we are almost out of time. But the first step, which is to assess the need for a systematic review, is what we'll quickly look at. When you want to assess the need for a systematic review, you need to search quite a number of places. That you have a question that you want to answer already, but you need to first look around to see if other people have answered that question, or if that question is already answered, or what can you bring into, what differences would you need to put into your own to make sure that it's distinct. So these are some of the places you can cite. You can search to confirm that your work has not been registered. Your work has not been, registered or done. Because in systematic review, like I said, you have to first register a protocol. You write a protocol, you register it, or you publish it, either way. In journal. Then you now start the real work itself of systematic review. And that's why it's part of why it takes time, because you also have to spend time writing a protocol, publishing that one, then you now start the real work of doing a systematic review. So these are some of the places we can cite. They are all hyperlinked up to registries that we have mentioned. We've mentioned Prospero, OSF is another one. Then we have specialty journals, such as the BMC journal known as Systematic Reviews, publishes only systematic review. Then we have databases like PubMed. I hope we are out of time. I hope by the next session we'll be able to demonstrate how do you search some of these things. For instance, when you're on PubMed, there's a filter for systematic reviews. After you run your search, you can always filter down to systematic, so that the only result you'll be getting will just be systematic reviews, and then you'll know whether your work has been done or not. But there are situations whereby a new review will be warranted. If the existing review, maybe there's a difference in scope, they might have considered maybe a demography of adults, and you are trying to look at adolescents, age group difference. There might be design, inclusion criteria might be different. Maybe the types of, because part of what you would decide a priori is that what type of research design or what type of studies are you including in your review. So the types of studies that they included in their own review might be different from what you are looking at. So a new review might be warranted. All those reasons why a new research may be warranted for us generally. All those reasons more or less apply. For instance, maybe they skipped some of the literature review, literature that were supposed to be included, such as gray literature. We'll talk about gray literature too, maybe tomorrow or next. And that's part of what will be. So a new review might, in fact, you could find a review, maybe a systematic review that is poorly done. Then you say that, we need to redo this. Or maybe it's outdated. For instance, if there was a review in the early 2000s that covered 1980 to 2000, it might be useful then, but currency, timeliness is very important when we are talking about evidence. So you might need to repeat that to see. And one thing is that you may also reach out to those people And that's one of the important things. Maybe you see a protocol that has been there for like 5 years. They've not done review. Because by the time you check Prospero SF, you see protocols that have been registered. You see whether they have been completed or not. And you see the date when they are. So if there has been a long time that they registered the protocol, you can reach out to the team and say, are you still in this? We are trying to work on this and all that. So it's always good to reach out. Even if you are doing an update study, you can reach out. Can we have some of the work you did before? Many of the researchers are outside, hopefully inside too. We are actually accede to your request. Okay, so we'll end it with this for this morning. Systematic review team. Remember I said you can't do it alone. It is impossible. You need at least a number of people. So number one are the subject experts. People who know about that topic, that issue, malaria, mental health, whatever. People, subject experts on the matter you are investigating. You need them to be on your team. Then we have method experts. People who have expertise in systematic review, meta-analysis. You need them to guide you through the process. We have missed this step, let's do it this way. Or when we are even drafting protocol, okay, these are what we need to do and all that. Information retrievers, usually librarians. If you don't have the expertise for search, comprehensive searching, you will need them. And that's part of the problem we have in the country. There are very few librarians who can support this, and that's part of why I always run away when people call. How many people are we going to be able to support in this, our university? And we are supporting, yes, this is our primary place, but there's a lot going on here and there. So we are working on that, building capacity of librarians too. But if you have expertise in search, maybe after the session on searching, you are able to grab it, run with it, learn it very well. You can always do your work by yourself. Then you might need other specialized method expert, maybe a statistician, or maybe a qualitative synthesis expert if you are doing that. Or if you are working in the field of economics, you might need to bring someone with that expertise and all that. So these are people that should be on the team. And also there are systematic reviews that are brought together, a stakeholder advisory group. The patients, the participants, trying to have feedback from them. Are we addressing the problem properly? So the advisory group are usually, when they are brought into systematic reviews, they are usually for feedback. Please look at what we are doing. There are lots we have planned as workshop or time and all that. One of the things we have planned as workshop is open science. And one of the aspects of open science is citizen science. So citizen science, if you know about it, this is an aspect of citizen science. You are bringing the people concerned into the research. So you are not just doing they are part of your research. At least they are doing the layman understand. Do you understand what we are doing? And all that. Feedback, so which is very important. Okay, we wrap it up with this, Time commitments. What does it take? How long does it take to actually conduct a systematic review? And you will see various answers in different literature, but I took this from Virginia Commonwealth University. I screenshot it's from a report, and they estimated the timeline to be that to prepare your protocol, you need about the first 2 months and all that. So they are saying that you need at least 12 months to do a systematic review. I would say you need around between 6 to 18 months, maybe 8 months, 10 months, 12 months, up to 18 months, because, sir, use 3 years. So we need to understand this, and we will understand it better by the time we start going into detail of all those steps. But remember, that is what is worth doing, is worth doing. Because it's at the peak of evidence. You cannot just do it anyhow. If you want to do literature review, go and do literature. If you want to do rapid review, it's fine. Scoping review, umbrella review, review of review, go and do it. But if you are talking of systematic review, there are methodological requirements and there are steps to be followed. And that's why we have all those timeline that just to guide us that it's not something that we can rush. You can't come and say, Mr. Wokola, let's probably see systematic review this year, please. So I hope we understand it. So we'll continue from here Our time is up, and I know the conference has a lot of things packed up, in program. So can we have any question? Are there questions? Okay, let's give number. Can we indicate hand? We have number 1. Okay, sir.